Welcome, everyone. Imagine testing a new medical treatment, product, or even a job applicant. Not on a real person, but on their virtual replica. This is the promise of digital twins, lifelike computer models that simulate real human behavior, biology, and decisions. Originally developed for machines, digital twins are now being applied to people, using real-time data to model health, reactions, and outcomes with astonishing accuracy. These digital doubles are entering hospitals, factories, research labs, and even corporate offices. But how close are we to using them as standard tools for testing everything from vaccines to emotional responses? A digital twin is not just a virtual avatar or a static simulation. It is a dynamic digital replica that reflects the real-time state, behavior, and performance of a real person. Using data collected from sensors, devices, and medical records, these models can be adjusted moment by moment to match a living person. The result is a simulation that can be used to test treatments, predict outcomes, and guide real-world decisions without needing to experiment directly on a human body. In the medical field, digital twins are already showing promise. For example, researchers are using them to model individual hearts, lungs, or entire metabolisms. By feeding in a patient's medical history, test results, and imaging data, the digital twin becomes a personalized testing ground. Before trying a new medication or surgery, doctors can simulate the effects on the twin. This helps reduce risks and improve outcomes. In the future, doctors might rely on these virtual versions of their patients during diagnosis and treatment planning. Creating a human digital twin starts with gathering massive amounts of data. This includes not only physical measurements, but also real-time biometrics such as heart rate, blood pressure, oxygen saturation, and brain activity. Wearable devices make this easier by constantly streaming this information to cloud-based systems. Machine learning algorithms then process the data to maintain an accurate digital model. Over time, the system learns how a specific person's body reacts to changes in lifestyle, medication, or environment. In addition to healthcare, digital twins are also used in product testing. Companies are building digital models of customers to simulate how real people will use new products. A sportswear company might simulate how a shoe affects different walking styles or how a fabric responds to sweat and heat. Automotive manufacturers use digital twins to study how humans will respond to new cockpit layouts or safety systems. These simulations help developers find problems early and avoid costly recalls. Training and education are other areas where virtual humans are gaining ground. Emergency responders, pilots, and surgeons can now practice on lifelike digital humans that behave and respond as real people would. These twins can be programmed with different ages, body types, or medical conditions. A trainee might practice CPR on a digital twin that simulates a child with asthma or an elderly person with heart disease. The system measures every movement and gives instant feedback, making training more effective and personalized. There is growing interest in using digital twins to predict long-term outcomes. For example, in a clinical trial, researchers might create a digital twin of each participant. They can then run virtual experiments alongside the real one. If a dangerous side effect appears in the digital model, the trial can be paused or adjusted. This could allow safer and faster development of drugs and vaccines. Eventually, most human testing might begin with simulations before moving to real people. Digital twins are also being explored for psychological testing. These models can simulate emotional responses to different stimuli, helping researchers understand how people react under stress or in social settings. They are trained using data from interviews, facial recognition, speech patterns, and even eye movement. Over time, the digital twin can simulate not just physical reactions, but also cognitive and emotional ones. This could be useful in fields like therapy, human resources, or behavioral economics. Making these systems work requires powerful infrastructure. The data must be processed continuously and stored securely. Cloud computing platforms handle the heavy processing tasks, while edge devices like smartwatches and health monitors gather the input data. Each digital twin must be updated in real time to reflect the current state of the person it models. This constant feedback loop between the human and the model is what makes the system accurate and useful. One area of future growth is using digital twins to simulate aging. By feeding long-term health data into a model, the system can predict how a person's body might change over the next decade. This includes muscle loss, reduced lung capacity, or slower reaction times. With this information, doctors and wellness experts can suggest changes in lifestyle to delay or prevent age-related problems. The goal is to give people tools to manage their health more proactively by looking at likely futures before they happen. Digital twins may also become companions for individuals with chronic diseases. These models can help track changes, suggest personalized therapies, and even alert healthcare teams when something seems wrong. For instance, a digital twin of a diabetic patient could track daily food intake, insulin levels, and stress patterns. If the system detects a dangerous trend, it can notify the patient or their doctor before a crisis occurs. This real-time monitoring could reduce hospital visits and increase quality of life. In the workplace, digital twins could one day be used to prevent injuries. Factories and warehouses are exploring the idea of modeling each worker's physical stress throughout the day. The system analyzes posture, repetitive motion, and fatigue levels. Managers could use this information to rotate tasks more intelligently or redesign workstations. This is especially helpful in environments where minor injuries can quickly lead to long-term disabilities. Digital twins could also be used in space travel and extreme environments. Astronauts and deep-sea divers are often isolated from medical support. A digital twin synced with real-time sensors could help mission control monitor health and simulate responses to stress or injury. If a problem arises, the team can try different treatments on the virtual model before applying them in reality. This adds a new layer of safety for missions that occur far from hospitals. There is the potential for digital twins to become personal archives. A person might choose to preserve a version of themselves that includes physical data, behavioral patterns, voice recordings, and personal memories. This digital version could someday be accessed by family members or future researchers. While this raises ethical questions, it also opens the door to new forms of digital legacy. The line between simulation and identity may blur, especially as virtual humans become more detailed and lifelike. Thank you very much for watching. Please like and subscribe. Digital twins of the human body and mind are already influencing medicine, product design, and training systems. As computing power rises and data collection improves, the line between physical and virtual may blur even further. These simulations could soon become mandatory steps in development pipelines across every major industry. Whether for safety, precision, or efficiency, virtual humans are poised to play a real role in shaping the future.